In this video, we are going to look at how to set up notifications for screening to be done. So we'll go to Setup, Charting Setup, and CDS Query Setup. So we're going to create a notification for height. So we will create a new query, and we're going to call this height due. And we're going to make it so that it notifies on the chart. So this is what makes it show up on the chart that this is due. So that's important that that one be checked. Let's hit save for the name, and then let's start adding in the criteria. So first, we want to put the demographics of the people that we're looking at. So we will put this as age 18 and over, and we want this to be valid Alberta patient. So I'm making the assumption that we're turning on these notifications for the entire clinic. If it was one specific doctor that we wanted to set up the notifications for, we would select one there, but I want it to be for the whole clinic, so I'm going to leave the doctor open to all physicians. So all we need for this line is the age and the client type, and we will save that line. Then we're going to add another line. Now this is where you'll have to talk to your docs and other staff to see where this information is entered. Usually it's going to be in chart notes, so we can select that. And first, before we get into the criteria, we're going to make sure that we check the Not button, because again, we're looking for people who are patients over 18 and they have not had a height. So that's why the Not box is very important here. So usually clinics have a few different places that they might put a height. For my database, we have 3. Physical exam for female, physical exam for male, and the ASAP template. So we're going to add all 3 with OR logic between them. So first let's add for the physical exam female. So once you select that, if you check chart fields and go down here, it will show you a list of all of the fields. Now just from experience, I know that in this particular template it's called HT for height. And the operator, what we're going to do is we're going to choose greater than or equal to and put 1. This is basically like a binary code. We want it to have something in the field, so that's why we have greater than or equal to 1. So now that we have all of this set up properly, we're going to save the line. Now just a note, because for the height maneuver, it's only once that a patient 18 and over has to have their height, so that's why we're not putting any criteria in for dates. So it's just once over 18. So we're going to add another new line, and this is also going to be chart notes. And we're going to look at the male physical exam this time. Now, this criteria up here, we want this to be OR, because we want to look in either a female physical exam or a male physical exam. And we also want to check the chart fields. And again, I know from experience that this is HT for height. And again, operator greater than or equal to 1, meaning that we want something in the field. Also, what we'll do for this is we're going to put this to level 2, and you'll see what I mean when I save the line. It shows it a little indented. So it's kind of like an order of operations where you put the brackets, and we're including all of these ors underneath this parent level. So this leaves us with one more to put in. So another new line and chart notes. Again, we are going to put it as OR logic and level 2. And this time, the note that we're going to select is the ASAP chart note. So again, we're going to check the chart fields box so that we can see all of the fields. And in this one, it is called the word height. So we'll choose that. Put the operator greater than or equal to 1. And then we save that line. So those are all of the criteria. So just to review, we have patients who are 18 and over, who are valid Alberta patients, and they cannot have a height in the female exam, or a height in the male exam, or a height in the ASAP exam. So now that we have all of our criteria, we hit save, and we'll close. So now when we run the report, we see that we get for various physicians, because we didn't restrict the criteria to just one physician, this is going to be clinic-wide. So you can see there's quite a few number of patients listed. Now, you actually wouldn't really run this report and look at it in this way. I'm just doing it so that I can grab a patient example. So when we check one of the people on this list and we look on their charting module, we will see that they have one notification pending. And if we click on that, we can see that the height is due. So that's how it ends up showing, and that's how it can help you to identify those patients when they come in that they need a certain thing done. So that is how you set up notifications for height screening.